Journalists, member of the foreign press, distinguished diplomats, welcome to the GPO's briefing, and we apologize for the delay. My name is Ron Paz. I'm the head of the foreign press department at the GPO, speaking to you from Sheba Hospital. We gathered here today in Zoom practically to better understand until when will we be restricted to Zoom meetings and what will happen till then. The government press office is proud to bring to your screens as the first English briefing to the foreign press, the key person in Israel's battle against the COVID-19. Professor Ronnie Gmzo, the manager of the project named Magen Israel, was appointed last month by the Israeli government as the director of the state's efforts in battling the pandemic. Professor Gmzo serves since 2015 as the Director General of Ichilov Hospital in Tel Aviv. And prior to that, for 5 years as well, he served as the Director General of the Ministry of Health. Professor Gmzo will brief you for about 20 minutes. Afterwards, we will take questions as much as the time will allow. Professor Gmzo, please.
Thank you so much. Thank you so much for your attendance and for your interest in what is really going on here and what we are trying to accomplish in containing the epidemic here in Israel. Well, all the world is facing COVID-19 pandemic, and we are trying here in Israel to contain it. We have a second wave. Let's realize really what happened here in Israel.
Go back.
Around February, we have done the correct measures and contained the epidemic. Then around March, we have done the correct steps of social isolation and lockdowns in gradual steps. Many countries have done that. Israel has succeeded to bring the numbers to a very low infection rate. And since then, there was a push in order to go back to normalization. And this is what happened here regarding school, commerce, almost any activity almost came back to normal. Maybe too fast. Maybe not in the most order way that we should look at corona infection. And this is what people are saying that happened here. And then we had the second wave. Let's realize really what is happening in the second wave in Israel that begins in the late May, beginning. First, we have to understand that the second wave here is characterized by younger people that are being infected. And this is a very vast kind of spread, not only in special, I would say, red cities, but all along Israel. As a matter of fact, it began in the center of Israel, Tel Aviv. But then again, we are seeing that all along Israel. We had around 16,000 cases at the beginning of the second wave. Now we have almost sixfold of that. And hospitals are still functioning and people are living, and we are trying to contain the epidemic, not in the way that we have contained it in the first cycle. So what we are trying to do. First, we had the government set forward regulation that minimize the people, the gathering rules within closed spaces and outdoors. This is accounts for restaurants. This is accounts for praying institutions, synagogues, church, mosques, all around all the closed spaces and the open spaces. And since then, we also blocked the gathering in events that has a scale and kind of behavior that people are joining each other. You can say weddings and something like that. So this was first step of the government, but still schools remained until the end of June and July. Kindergarten remained until, 10 days ago. Summer schools and summer kindergarten still remains open. All the, I would say, commerce life in Israel are open. All people that are going to work still are open. And Israel, as a matter of fact, when you are comparing Israel to other countries that have a lower number of cases per population, Israel is more active. Looking deeply in Israel, let's realize the number of people per household in Israel is higher than the average in the Western world. Taking, for example, the extreme Orthodox and taking, for example, the Arab population, we have to face that our challenge is, more tougher here. How to deal with that, and because people are being, catching the corona or being infected within the household. So what we are trying to accomplish? First, we have to realize that containing corona is not only a medical situation. It's a social, economy, challenge that you have to balance. What are you doing to the economy? What are you doing to the social life? What are you doing to our citizens? And balancing it with the actions that we are taking regarding keeping their health. So the main thing that we have done during the first cycle, and I was responsible for that, is keeping the aged people okay and being able to keep the nursing homes in the best way possible and diminishing to the minimum possible infections and people being infected with corona in the nursery home. And we have succeeded in that. But still, we have elderlies elsewhere around our population. In nursery homes, we have 100,000. All around Israel, above 65 years of old, we have around 1 million. So still, this is a population that we have to keep safe. And we have succeeded in that so far. Still, I'm worried, but so far, only 10% of the infected people, people that have been infected with corona, are above 60 years of age. So this assists us in continuing the struggle to combat and to contain the disease without locking down, again, our social and economic life. Another issue is how the hospitals and the community care is managing. We have around a day 20,000 people in active corona in our HMOs, our 4 HMOs, being treated in the best way possible. In hospitals, general hospitals, we have around 800 cases. Half of them are minor or mild to moderate. Half of them are severe, but still the severe are, part of them are younger, and most of them are going into gradually into the moderate and the mild case and being discharged. Still, we have to look for the way that our hospital is still operating in this stressful event. And we have to remember, they're still doing that, giving the best treatment in the world, because the case fatality in Israel is the lowest, really the lowest in the world. People were talking about the German, really magical way that they treated their patient. Israel is doing even better. Still, this is really going on the sideways and really going on the tip, but doing that in order not to go so fast into lockdowns. So this is what we are trying to do. So what is really the actions that we are taking? Preserving hospitals, reinforcing them, reinforcing the community care, and parallel to that, we have to build up our infrastructure. Infrastructure for what? For continuing the struggle with Corona for months to come. How do you do that? 3 main infrastructures that you have to build. First one is the trust and the confidence of your people in what you are doing, because they are the most important player in this equation. They have to trust you. They have to understand what you are doing. They have to know the disease. They have to know what is really the risk and what is not. And really to understand that putting a mask and not gathering really is the way to beat the Corona. And you have to do and to keep up relationship of trust with them. Second infrastructure. The infrastructure for cutting the chain of infection. What is the chain of infection? The minute somebody feels really with signs and symptoms of Corona, even before he's testing, cutting the chain is going into quarantine, and then doing the sampling, the test, and what is called the inquiry, questioning really what happened, where were you, who did you be in contact with, contact tracing with questioning, and then sampling again the people that were in contact with you, and then the positive cases, again questioning, and then answering and quarantine who is really being exposed. This is not working well in Israel. I don't know where it works really good around the world, but it's not working here. And this is what I'm trying to accomplish, to build the infrastructure. It will take me another 2 weeks, another 3 weeks, more or less. And the Israeli army is doing that with the best of technology, with the best of people. And you know what? We are looking at any single step. We want to jump in on any case, to question, to understand the contact, to do the contact tracing, and then sampling, testing, and then quarantine, and cutting the chain. Cutting the chain makes the R, which is the coefficient of infection, going down. And when it's not 1, it's 0.8, the epidemic is going down. So this is the second infrastructure. The third one is managing, creating a managing facility in each city. Corona is not being managed from the central government. The central government only gives directives. You have to manage it within the community, within the cities. Each mayor has to build his own managing body with the Israeli troops that are looking in the cities, with, of course, the HMOs, with the Ministry of Health, with of course, the police, and he knows better his neighborhoods of each city. Cutting the chain of infection can be done better within the cities, not from the central government, not from the country. And this is not the way to go, not only now, but forward. because we understand that if we will have a lockdown, let's say I'm not succeeding and the government of Israel wants lockdown. Once you enter lockdowns, reopen, then you are in the challenge. Then you have to have the infrastructure, trust, cutting the chain, and managing within cities. This is my plan, which I call it the shield of Israel. It takes time to build it. I'm only 3 to 4 years in position. The army is now well in, and I believe this is the way to go. Will we do lockdowns as another, I would say, tool in order to cut the numbers down? Could be, but I'm trying not to. Doing my best not to. I'm seeing what's happening in all around the world, and I understand really what kind of unemployment you achieve or you create with lockdowns. It's, in many countries, an economic disaster. And I'm trying to balance to achieve what is possible for the sake of health and for the sake of the country in a gradual steps in order to have the infrastructure ready in any case for continuing the battle with Corona. Thank you so much.
Thank you very much, Professor Gamzou. Now we will take some questions. Now, some of you face technical problems to log on. So if you're not on the screen, I will ask the question on your behalf. And starting with Joe Federman from AP. Joe asks, could you explain, please, why you feel the need to bring the military and what exactly the Army task force responsibilities will be?
We have to understand, cutting the chain of infection is not a health issue. It's not a health expertise. It's an operational expertise. Looking ahead, trying to find the one that has symptoms, running very fast to do sampling, testing, positive result, questioning, inquiry, and quarantine. It's an operational task. And once you are facing that all around your country, many cities with a very varied kind of characteristic of each city in Israel, you have to have the best operational forces. And in Israel is the IDF, with the best of technologies of the IDF.
Thank you. Rosie Scammell from The Guardian, are you with us? I can't hear you, so I will read the question on your behalf. Professor Gamzou, could you please provide the infection rate in East Jerusalem? It's been reported to be 44%, and explain how the Israeli authorities are addressing coronavirus among the communities there.
Okay, it's not 44%. What's an infection rate is kind of a phrase that I really don't know what did you mean, but the infected people in East Jerusalem, out of all infected people in Jerusalem, entire Jerusalem, is around this number. If this is what you have meant, then you are correct. What we are trying to do. First, let's realize what we have in East Jerusalem. It's a crowded kind of neighborhoods. The demography is very challenging. Number of people per household is very challenging. How do you challenge that? How do you combat? How do you really succeed in such a setup without a lockdown? And again, let's remember, lockdown is not so easy in such a society. It's not easy when everybody in Israel are not in lockdowns. So you have to manage it within the population, within the community, with the leaders, first the leaders of the community, not only the mayor. The real leaders within each neighborhood have to understand and to assist us. And we are giving all resources, everything that is needed. Of course, tests, but not only that. We are making that very, very at the place, accessible in a way that people will go to do sampling and testing. And then really questioning and doing the quarantine in order to keep them healthy. And we are also providing people to be to go to hotels in order not to stay in the crowded neighborhood and to infect other people. So this is really challenging. But you know what? I'm optimistic because East Jerusalem people take responsibility on their future, take responsibility on their health, and we will give them anything that they need. But we will do that together at the first place without lockdown.
Thank you. Karin Kosina, Deputy Head of Mission from the Austrian Embassy, asking, in some countries, such as Austria, travelers can enter without having to go into quarantine if they present a negative COVID-19 test. Is this something that Israel is considering to do as well? And if yes, can you tell us more about what this might look like? And if not, why not? What are your concerns about this approach?
I believe that the way to go entering any country in the world should be by risk management. When people are entering with a country that is green, a low number of infected people per population, you can let them in with or without testing. When you have countries that are in between, you can let them in with testing. When you have countries that are in the red zone, you must have a test and some days of quarantine. This is my belief. At this moment, 3 levels: in without testing, in with testing, and in with testing and quarantine. We are trying now to see what is more suitable for Israel, but still we have to wait for the tender for the Ben Gurion airport to allow people to have tests within the airport. Another issue is that I believe that the risk management should not only be per country, but per and tailored for the individual. And I can understand, or I can tell by, all kinds of smartphone application where he has been. And then managing the risk per individual. But this is yet to come. We are trying now to build up such a way or such a technology.
Thank you. Ruth Iglash from Washington Post, are you with us? Can you hear us, Ruth? Okay, Ruth was asking about the opening of the school year. What are your concerns in these regards? 2 weeks from now.
Yeah, no, it's part of Israel is 2 weeks from now, first in September. The extreme Orthodox are opening the end of this week. It's what is called by the Hebrew calendar Aleph Elul. It's a real challenge. I believe that we should separate the lower classes and the higher classes. The higher classes above the age around 12 have almost the same infection rate potential as the grown-ups. So we have to look differently between these 2 layers. The first layer can come into school in capsules or in a way that we allow maximum number per class. The other layer should, in my belief, be looked in a different way at the range of staying at home totally, or staying at home doing remote kind of studying, and coming a day, around a day, a week, in order to be in such a frame. So this is the way that I see that. And really, it's not so simple. And we really look at that as a risk for pushing up infection. And I'm at the Israeli cabinet, at the government on Thursday. I will present that, present the pro and the cons, and the Israeli cabinet will have to decide.
Thank you for that. Sharon Itza from La Repubblica, Italian daily. If the principle, the more tests are performed, the more infected people are revealed, if that is correct, does it mean that those countries who perform more tests have more chances to be listed as red countries? If so, wouldn't it be correct to set a uniform global criteria for testing?
When a country is doing a huge number of tests, and the proportion of the positive result is below 3, then everything is okay. When the country is doing a high number of tests, but it's still above 4, this is the situation in Israel, then we still have a community kind of transmission. So this is not just looking at the number of tests per population, but looking at the rate of positive result at a specific country. And when you have more than 4%, then you have to understand that you have community transmission at that country.
Thank you. Ariel O'Sullivan from Khan English News Radio is asking, the Israeli public seems to have lost credibility in the government's ability to make timely decisions on steps required to curb the spread of coronavirus infection. What steps are you taking to repair this credibility and bring the public a greater discipline?
First, I'm saying to the people of Israel, to the public, really, I'm trying not to push for dramatic lockdown steps. So this is not taking steps because of lack of leadership. Is not taking steps because of leadership, due to leadership. I'm trying to explain. I'm pushing myself and I'm pushing the entire system to try to combat and to contain Corona without lockdowns. I'm not sure that I will succeed. And this is what I'm saying honestly to the people of Israel. On the most honest way, I approach them. And I'm saying I'm trying. I'm not sure that I'm going to succeed. But really, I have a strategy to try to keep us away from another lockdown. What's happening around the world? You have lockdown in Auckland for 20 cases. You have lockdown in Victoria County in Australia for lesser cases. You have lockdown in Spain. You have lockdowns in many places. This is the most, I would say, first step that countries are taking. I'm trying hard to contain it without another lockdown. And this is building trust, because I'm saying really honestly the truth.
Moshe Appelbat from the Brussels Times. Contact tracing is crucial for containing the spread of the coronavirus, but in most countries during the first wave, it was hardly in place because of high infection rate. In Israel, the government decided to apply a military intelligence application, which wasn't very effective. What is the situation now? Does Israel have in place a manual system or a digital tracing app which complies with the data protection rules as in the European Union?
Yes, Israel has an application that it complies with the data regulation, the privacy rules, but most of the Israelis really do not use that. They do not download it. And this is because people really doesn't find the big brother approach as something that they will on their own decides to use it. We are using another kind of contact tracing that is on the intelligent base, but we are trying, it's under the law, we are trying to keep privacy. But just to let people know that they should enter quarantine because they were in contact with one, we do not say who, we don't give any clues, with one that was diagnosed as a corona positive case. But really, my main mission is to do manual contact tracing and do that in the most efficient operational way and to get the cooperation from the Israeli public. And this is what we are trying, and that is what we are building now. And this, for me, the way to go, the way to understand, the way to ask our citizens, really, this is the hard way. We are going from sampling to testing to positive result, and then I will approach you. And then we'll ask you, who was exposed to you? And then I will get and ask them. This is manually. This is, strenuous. But I believe this is the way to
go. So Yeun from KRM Korea is asking, Israel has opened the air for international travel between the green countries. We heard that South Korea was one of the green countries, but didn't make it to the final list. What is the decision criteria for selecting green countries?
The final list was two countries, Croatia and Bulgaria, and part of Greece on a ceiling number. It is an issue that the Ministry of Foreign Affairs is dealing with and trying to make it bidirectional with the countries. So I'm not sure what is really the regulation about Israelis that entering South Korea, but if they have to stay in quarantine, then it is vice versa the situation for South Koreans in Israel. Israeli that are coming from South Korea. If South Korea is regarding green, Israelis and people with permits do not have to stay in quarantine. And if it's not the case, then I have to understand, because I know that South Korea is a green country.
Karen Seaton from the Chinese news agency Xinhua is asking, what kind of cooperation is there with China? How do you assess China's efforts against the virus, and what can Israel learn from this? Is there any cooperation with China on the vaccine?
Me, myself, and many other people from the healthcare system, and of course from the government, has close relationship with China. And we are sharing information, sharing experience, and trying to have Chinese experience in technologies and in other issues. Many companies from China are being involved in Israel. For example, BGI. Many of our tests is being performed by the BGI technologies and others. And I have myself close relationship with many leaders in China from several counties. And I'm looking forward in tightening more and more that. And China is a friend. We are trying to have it more and more.
James Marlowe of the Jewish Tribune asks, there's still no COVID-19 testing taking place at Ben Gurion Airport for incoming passengers. I understand this system has been put out to tender. So when is this going to happen?
In a month's time. This is really a challenge for the Ben Gurion Airport, and I will assist them in any possible way because I believe this is the way to go for the incoming and the outgoing. So it will take place, and I'm promoting that. Still, it is not my responsibility, but I'm doing any effort possible to let them win the process as soon as possible.
Okay, that concludes the prepared questions. Is there anyone listening that wants to ask another question?
Can I just follow up on my previous?
Yes, yes, sir. Please, we hear you.
Thank you very much. And first,
could you present yourself, please?
I'm James Marlowe. You just asked my question. And thank you to Ron and thank you to the GPO for setting this up. And thank you very much again to Professor Gumzo for the detailed explanation. Just to be clear, Greece and other countries do have this COVID-19 testing when they come into their airports as well. You mentioned you hope it's going to be done next month. Why is there a delay? Is it because of the arguing taking place as to which tender is going to win this battle in order to do the testing at Ben Gurion?
No. It's not because of that. I'm not aware of any battle or any kind of conflict. Just, in order to put forward a laboratory or a system, you need some kind of a process. The last, I had a word from the CEO of the Ben Gurion Airport. They gave me around 4 weeks. I will look deeply down into that in order to make sure that they do not have any kind of barriers. I will push aside any barrier that is blocking them.
May I ask a question?
Yeah.
Yes, can I ask a question, please?
Ron, this is Walter Bingham.
Yes.
I read that Professor Gumzo is proposing a complete lockdown for the Jewish high holidays. Are you really serious?
The Israeli TV yesterday has released that, but it's not really the case. Let's say what we are doing and what we are trying to do now. We are trying to contain it for the next 4 weeks, to contain it until we will reach containment and lower number of cases. This is what I'm trying to do. So I'm focusing now at the Aleph Elul, beginning of the Orthodox education, at the 1st of September, beginning of schools, and the case of what Israel, how Israel is going to manage itself in the holidays, in the coming holidays, it's really an issue. We still didn't decide. We still have work on that. We are looking at that. We are seeing what is the best way. Because, this is not lockdowns in Israel. Because there are prayers in synagogues. It's the most holy holidays, and people are looking forward for that. So this is really an issue that is not being decided yet. I will raise my first thoughts in the cabinet 2 days from now, but this is really not have been decided yet. And it depends on what will happen until that. We have about 4 to 5 weeks until the beginning of Rosh Hashanah.
Thank you.
A follow-up question, please, from Ruth Iglash from the Washington Post. Read the schools reopening. She's asking, the hospitals are saying that they can only manage between 500 to 1,000 serious patients. We dropped to 400 today. But with schools opening and high holidays 2.5 weeks later, what will we do to keep the system from breaking down?
Wow, this is a very, very smart question. Really, this is my focus because really, I'm looking at the beginning of the schools in 1st of September, and I see that I'm with the serious number, the number of serious cases, and I have to be, you know, really focused in order not to make a decision or not to allow something to happen that we will tear apart all what we have achieved now. We have achieved containment. Number of cases are a little bit going down, but steady state. And hospitals are taking hold of that. And really, this is a very delicate situation, and you have really pushed at the very, I would say, challenging point. And this is what takes hours of my sleep any day.
Yeah.
Hi, Josh Haston here.
1 second, please. Another follow-up question from Inga from Germany. Professor, did I understand correctly that Israel still doesn't have a tracing app? If yes, what is the problem?
Israel has a tracing app, but I was saying a tracing app that uses even Bluetooth technology, that is make it more accurate and precise on the location issue. But still, not many Israelis are downloading it. And in Israel, this is not mandatory. There are places in the world that have made it mandatory, but Israel democracy, it's not possible, of course.
We have time for one last question.
Josh here from
anyone?
Josh here from JNS News. I just wonder if you can just clarify. Maybe I missed it. Maybe I missed it before in terms of where we stand now in terms of Israel's R number and the way that it's trending. Perhaps I missed it earlier, but if you can just clarify where we are today and in which way it's headed.
The R number is around 1. It was above 1, went down to around 0.9, and now it's around 1 again. Why is that? Many parameters. I won't get into that, but it is around 1, which is kind of an accomplishment in a country that is, you know, fully busy and almost nothing is shut down. But it's not confident enough. You cannot run a country with an infection rate of 1, mainly when you want to promote schools and normalization. So this is what we are standing at. I'm making the efforts in order to build the infrastructure that will cut chain of infections and reduce the R to 0.8. This is my target. Once it's been reached to 0.8, then we know that the epidemic is diminishing. But this is my efforts. I'm not sure that I'm going to succeed. I'm getting the credit from the government each week. Each week I have to fight for the credit, but this is okay. This is balancing risks and looking at the health issue and the economic, social issue.
Professor Gomzo.
Ron, I have a follow-up question.
Have another question, please.
If possible. Hi.
The last one, if I may, because I
have a follow-up question regarding schools, if I may. It's Ana Cárdenas from the Spanish news agency EFE, because everybody is looking now, all the world is looking now to the going back to school, and Israel already had a first experience. So I would like to know if you know if there were mistakes in the first going back to school, if there were, which were them, and how are we going to avoid them now? So what is the learning that the world can get from the first experience of Israel going back to school? Thank you.
There is a dispute whether the second wave is coming from the opening of schools in Israel. There's a dispute. So this is why I was saying opening the education year is some kind of a risk. And I understand that. This is why I was saying, let's cut it in between. the lower classes and the higher classes. So to give you a truly correct and most confident, clear-cut answer, nobody can say that for sure. There is a risk here. And I'm trying to bring it up to the government, and I know that they will weigh the risk and the benefit, the Ministry of Education and the entire government. Thank you so much. Thank you so much. I have to leave for your patience and your cooperation, and I hope that I made things more clarified. Still, we can do another one in next week. Thank you so much.
Thank you very much, Professor Gamzou. Thank you all for joining this GPO briefing. Take care, stay well.
Thank you. תודה רבה. Thank you.
תציג אותי מאחורה. כן,